Audio Jungle.
Hello once again. I'm now going to show you the technique of the application of hot wax and also strip wax. So the first thing you have to do when you have your client come in is that you have to do a thorough consultation. And in the consultation, you have to look for what contraindications, things that will not make you to do that treatment. We've discussed contraindications earlier in the lesson. So once all contraindications are ticked and you know your client is good to go, these are the processes by which you would follow. So number one, for strip, you will take your pre-cleanser in a cotton pad and wipe clean the area that you want to wax. And because waxing is actually a painful treatment, client comfort is very important. So you must ask your client if they are comfortable and just make them as comfortable as possible. After you've cleaned the area, you can see this is the reason why we're cleaning, to remove any surface dirt, any form of bacteria on the skin. We don't want to introduce that into the pores. So secondly, you will need to first of all test the temperature of the wax on yourself. There are some times that the temperature dial on the wax spot might be mistakenly turned up. You always have to check the temperature of the wax on yourself. Once you know that it is not hot or burning, then you know it is ready to be applied on your client's skin. So first of all, we're going to be applying the strip, which is also known as the warm wax. You take your wax from the pot on the spatula, and the technique is that you will always look at the direction of hair growth. And that is how we do our application. If you do not follow the direction of hair growth, you will not, that hair will not come out. So you will put your wax spatula, you put it at an angle like this, and you apply. By the time you're getting to the end, you can turn it down. So you apply along the hair growth. Once you're done, you take your strip. You're going to remove against the hair growth. When it comes to strip or warm wax, you apply your wax along and remove against. So you put your strip, making sure that you have excess to hold. You always have to pull the skin, no matter the area. The leg is very taut, is not a flabby area, but you always have to pull. You pull, and then with a strong pull, you yank the strip off against the natural hair growth, and your hair will remove. The next thing, you move to the next line. You make sure you pull and remove against the hair growth. You will have the hair removed neatly, and we're removing the hair from the roots. So it's going to take from 4 to 6 weeks for her to have a regrowth. If you have areas that you need to tidy up, you tidy up this way. And that is the technique. The next step to this is that you would now clean the area with your after waxed oil, because trauma has been applied to the skin, and naturally in most people there will be a reaction. So just to calm that reaction, we're going to apply the after wax lotion on the area that we have waxed. So we apply on the area well. We're not waxing our whole leg now because we're only showing you the technique of application and removal. So you put your after wax on. Once you're done with the waxing, and you make sure that you give the client aftercare, the do's and the don'ts that they should do for the next 2 or 3 days. I'm now going to show you how to do the front part of the leg and also the knee. If we're doing waxing, is you can do a full body wax and you can also do different parts. So for a half leg is above the knee down, both front and back. So I'm going to show you the front, the knee, and that is that. So the leg has been cleansed. I'm going to take my wax, which I am setting of the temperature. And this wax is thick. I'm going to bring it to the client. We can see that she has a wound or a scar that is still healing here. So I'm going to try as much as possible to avoid it. I'm still going to wax around it, but I'm just going to avoid it. The best technique is to make sure you apply all the wax that you want to use on the area. Apply it before you start removing. So take our strip, remembering to make sure that we leave allowance for the pull. We'll rub it, we'll give it a good rub. We pull, we remove. Sorry. The lighter you apply your wax, the better. So what I'm going to do is that I'll fold this edge so that I can use the other part. And our wax, they come in different colors, they come in different flavors. The one I'm using at the moment is a lavender wax. That is why it appears purplish or lilac-ish. You can have a honey wax, you can have a tea tree wax, you can have a cucumber wax, depending on the sort of treatment you're looking for. Lavender is known for calming properties, and you can see the good thing is that about waxing is that it also lifts dead skin cells. So you can see the brownish tan, that is just old skin that is ready to be lifted. So once you have this, you have to clean up. There's tendency for you to have wax residue. That is why you have to pick an after wax lotion that would help to remove any wax residue. So it's just for you to check if there's any hair that has been missed so that you can go back and wax it up. You don't want your client to get home and they'll see strands of hair where you have waxed. And you can see just build up of dead skin cells, and you can see the difference. The skin here is brighter. So this process is going to be applied on the sides and everywhere. But for the knee, if you want to do the knee is a bit tricky. You have to bend your client's knee so that it forms a taut feel, so that it's not loose. The skin there is not loose. So I'm just going to wipe her knee because I can remember I didn't wipe that. We don't want to introduce any dirt or surface bacteria. So it's just to show you the technique of the knee. And you make sure that everything is wiped and dry before you apply your wax. Make sure that the temperature you start with is actually maintained. So you can see that we're following the direction of our hair growth. We're following the direction of the hair growth. If our hair was growing upwards, I would move my spatula that way. It's very hard to wax the knee if it's not folded. So you take your strip the same way, you apply a bit of pressure and giving allowance to pull. If you ever have an issue where the hair is not coming out, you have not followed the direction of hair growth if you are using the strip wax. And always remember to pull. Even if you have any form of wax residue, your after wax lotion would remove it. So you can see we've only done like 3/4 of the knee. You have to move your client's clothing and then continue. So we apply, we apply. You apply, you apply, you apply. The thinner your wax, the better. So you make sure you give it a straight line at the edge here because you don't want it to be uneven. Take your strip again. And you remove. You can make sure that you press it hard and then you pull. Always the key to waxing and not bruising your client is making sure you pull the skin. Sorry. Make sure you pull the skin. And sometimes waxing can be messy, so I advise that you don't use your expensive towels or luxury spa towels. Simple cotton or Ankara or something like that is enough for your client to wear. And when you wash them at high temperatures, the wax will melt and you have your linens back. So that is that. We're now going to apply the after wax lotion. That's why you have to do research on the right products, because a lot of times you would have this sort of residue on the skin, and the type of wax lotion you use will determine. There are some after wax lotions or oils that will not remove wax residue and your clients will feel sticky after. It's best to get a brand. The only part we've not waxed here is this part, which I'm going to wax now. I'm just going to try and go around the scar she has. This has not healed properly, so I'm just going to try and go around that. But you can see that I'm not applying the after wax lotion on that area. Because when you want to apply your wax, you don't really want any form of barrier between the skin and the wax. And oil can be a barrier. Body lotion can be a barrier. That's why we clean. So I'm going to apply here first. The reason why we are not waxing over that wound is because we can open it up. We can disrupt the healing process and cause more injury to that area. So when you have clients like this, you don't just say, oh, we cannot wax that part. You go around the wound and then you go around it and remove as much as you can. So sometimes you have incidences like that whereby you have not, so you pull. It's good that that happened. Sometimes you have incidences that you pull and the wax will not come out. It just shows to you that it's either your wax strip is too full or you have not really pressed down properly. So it's just the other part and we're done. You don't wax, according to your previous lessons, you have learned that you don't wax over moles, any recent scar tissue like this. You don't wax over it because you can mistakenly open up the wound again. And we don't want that. Our client today is just a perfect example to teach this aspect. If you still have any stray hairs, you can tweeze around it. So we put our after wax oil. Just to soothe the area and remove any wax residue. So we're done. And that is it. And the same technique is applied. You turn your client around and wax the back. If you need to do a tie, you expose the tie, you follow the direction of the hair, you remove. And that is the technique and method for strip wax which we have used today.